Welcome to Healing Through Dentistry,
where we redefine health, wellness, and the power of your smile.
We are your hosts,
Hana
and Eva,
twin sisters,
qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into the profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to Healing Through Dentistry podcast
with your host, holistic dentists and twins, Hana
and Eva.
We're so grateful that you are here with us. And today we'd like to discuss yet again what in our mouth can affect your overall health.
So the biggest part would be chronic inflammation.
But what is chronic inflammation? What is in that bracket?
Lots of clients, they come with gum disease. But what is gum disease? They basically come with bleeding gums. So the signs of inflammations are bleeding, swelling, and pain. So these little symptoms for some clients, big symptoms for other clients, they mean chronic inflammation. Sometimes hear about periodontitis, which is further bigger inflammation of the gums because it's inflammation of the gum and surrounding bone. And we can prevent that. We prevent this with dental hygiene, but also we prevent that the fact that we have great emotions, because even though we come to see dental hygienists every 3 months and we care, if we have emotions like fear or anger, we would create acidic environment for our body, for our cells, and they're not able to heal.
So what I was trying to say, it's no longer enough for your teeth to be healthy, only brushing, because we see on our clients that they do see our hygienists every 3 months, what we do recommend to them. But still, they do have issues. So we started to question, how is that possible and why do they experience this?
Yeah.
And so we see that on many clients, and it can be a student of medicine. We've got a lot of medical students here in Brno because it is a university city. So they do come over. And we've got medical students, veterinary students, but other students who, in their eyes, and we know, we can imagine what they're going through because we've studied a long time as well.
Yeah.
And the amount of pressure which is on you and the amount of information, I cannot actually imagine now, Eva, with AI and, more data and more opinions. So they come over and they're stressed. So they're levels of stress are, breaking the roof. They can't sleep, they groan, they clench, they sometimes snore, they don't breathe properly, and they can't sleep. Did I say they can't sleep as well?
The gums suffer.
And of course, the gums suffer is our message for the podcast in general and for this discussion is that everything is interconnected in our body, which means if there is an inflammation, a stress in your body, which is an inflammation, an immune response taken as an inflammation, or, it's the constant flight and fight response because you're constantly in a sympathetic mode, which is greatly built in our body because it's needed, when you see a car close to you that you jump away and you're not being, driven over. But on the contrary, this system shouldn't be working 24/7. We can't be stressed 24/7 because that's just gonna kill us, basically. So this was kind of a very broadly said what we're, trying to explain to our clients, that they not only need to see the hygienist, regularly, consistently, not just every 3 years or every 2 years or whenever there is a problem, but ideally regularly. For me, it works every 3 months. But also they should question other parts of their and lifestyle of their lives, meaning their stress levels, meaning their nutrition, meaning their movement, exercising, meaning their sleep patterns and more. Like we were talking about 8 pillars. Do we want to say 8 pillars? What is it? 8 pillars of healthy, not only smile for us, Eva?
Yes, but before that, I was just going to say about the chronic inflammation that I see two groups of clients. One group has no dental cavities and no fillings, and the other one has dental fillings, dental cavities. And I usually say to clients that if you don't have any fillings, you're more prone to have the group of bacteria which are causing gum disease. So we can get ready for that better. We would know that for you, it would be great to rinse with salt water to bring the mouth into alkaline background, because these bacteria, they disappear, they don't thrive on alkaline. And again, its emotions are acidic, so bring the good emotions, bring down the stress, sleep well, and that's
Eat
one
well.
part. And eat well nutrition, which is alkaline, again, vegetable, and vitamins and minerals, because usually we lack of vitamin C when the gums are bleeding. So there is more into it, but just basically distinguish two groups of people. Lots of people, they don't have cavities and dental fillings, but at the age of 60, they would come and they may lose all teeth because of the gum disease. So that's one big one. Would you like to go back to the pillars?
The pillars, yeah, maybe we can just repeat them because I started to say some of them. What I think in our eyes is crucial or very important in our health, and that is nutrition, that is exercise, that is prevention, that is sleep, that is beliefs like good thoughts and beliefs or power of consciousness, that is forgiveness, that is joy, and that is sleep. I think we forgot.
Yeah.
And that's the 8,
Pillars.
I'm sure you might find more stuff which is very important for our overall well-being, but we believe this is just the core.
So that was the biggest box of chronic inflammation in your mouth, which is gums. But also what brings you chronic inflammation is when you have root canal treatment, which is basically when it happens or it is performed when usually you have either trauma and you break your tooth in a way that would lead into your middle part where the blood and nerve goes and it's damaged, or it's because the dental decay was that extensive that it led to this area of nerve and blood. And basically, you have had the root treatment performed in order to devitalize the tooth, make it dead, and just to make it for you to chew. So, functional mechanics or reasons. But what we see in our holistic dental clinic is that we really see health benefits when people they lose these root canal teeth. First example I would give you with the molar, because the back molar, first molar, is the tooth which is coming through at the age of 3, so we see lots of damage there.
At the age of 3?
At the age of 6.
6 is that 3 times 2? It's the first molar. Yes. It's the first tooth we actually get when after baby teeth. Maybe I'm just going to jump in just to say for parents or caregivers, because this is something very, very common what I see in practice, that parents are not aware that their kids actually having adult tooth already, because their perception is, oh, they haven't lost any baby teeth, they haven't lost anything, how can they have anything new in their mouth? And that's because the very first molar grows after behind the baby teeth. So you've got like 5 baby teeth on one quadrant, or like 10 baby teeth together in one jaw, and behind the very last ones we see the first molars growing into our mouth. That's around age 6, can be anywhere from even like 4 to 7, even maybe 3, I don't know, Eva.
Yeah.
But that doesn't mean 6 is the number. And that's why we do also see a lot of issues with that, because a lot of parents are not aware that that's the new adult tooth and they're not taking care of it for their kids. They think like, oh, it's a baby teeth. And unfortunately, there's this perception which the whole population in the world is having. Well, if I have a baby teeth, I don't have to actually care about it much because, we're going to lose it and we're going to have an adult teeth, which is wrong attitude. But also what I'm trying to say, the very first molar, we're not aware of it, or some parents might not be aware of it, that it's actually adult tooth and they're not looking after it. And that's why we see in our practice a lot of people having issues with it.
It starts with dental filling. If it's amalgam filling, the metal filling, it expands, it breaks the tooth. And then clients need root canal, not in a holistic approach, but they have root canal and they come with root canal. And lots of our clients, they come with, if I just talk about one specific example, is one client, he comes with Crohn's disease, which is an inflammation of your bowel. So it's affecting the intestine. And he had chronic inflammation on root-treated teeth, which were back teeth, the lower ones. It was also the premolar. So he had 3 inflammations he came at the age of 40, super young. And he was very surprised how quickly he had results because we decided to remove the teeth. He actually came for that treatment. He came for ceramic implants because we have lots of clients who are coming with the knowledge and they know what they want, and they were looking in a Western medicine, they couldn't find answers, but they come across usually with information about teeth. So he came, we removed both molars and 1 premolar, and he said it's interesting that his knee stopped hurting. So that's what he was not expecting. He didn't even expect that his Crohn's disease would disappear. So there is no diagnosis of Crohn's disease. So very grateful.
And that's what I was trying to say. Like every single tooth is lying on a meridian, on a path and connecting certain body parts. And so we see through our traditional Chinese medicine interactive map, or through our whatever knowledge what we've got gained over the years, that certain teeth do give certain symptoms. So the knee symptom is very often, because that's to do with the lower molars. I just explained, they're just quite often damaged. But I've got many clients who do complain about digestion or bloating or digestion issues in general. It doesn't necessarily need to be diagnosed like Eva's client who's had a Crohn's disease, or it can be ulcerative colitis. It doesn't need to be, but there are people like that as well because they do have issues. And it happens a lot that these people do see many doctors before, but obviously if there is the blockage of the energy on their tooth in terms of the root canal, then that's blocking it, and it's contributing to the inflammation of their bowels.
Plus, I like to say to clients, the body is so powerful that when you have immunity holding on or helping on that area of the molars, lower molars, it would be missing on area where it's linked, which is the intestine and lung, and linked with the spine, and according to a traditional Chinese medicine.
Yeah, I can share one another experience with molars and gut issues. I've had a young person, he wasn't even 25, I think it was a student from Austria, and he came over with root canal treated tooth, which was very obviously very much inflamed even on 2D image. Sometimes we need to take a 3D image, which is a CT scan, but in this case it was just so obvious. And overall, like all the root canal treatments actually are source of bacteria and inflammation. We do know that from many and many studies from others, but also like what I explained before I just go to the story, what I explained to my clients, like why is it that there is an inflammation, and why is it like they've just spent so much money and time and effort to correct the tooth, they've had root canals and crowns on top of the teeth, but why is it that they still have an inflammation there? And I always explain it in that way, that the inner side of the tooth, where there is the root canal treated filling, is just so very complex. You can imagine it as in like a tree, a big tree, oak tree, without the leaves. And you see that the tree has got one trunk that can symbolize the ground, but then it's got like, let's say, two main branches, and that can be the two main branches you can probably imagine or visualize or see on your x-rays. But those two big branches, which can symbolize again the two roots on the lower molar, have millions and millions of another branches, middle size, smaller size, mini size. Like we all know how the tree looks. And it is impossible, even though we are trying, and the Western medicine was trying, and I appreciate people who, started to do this in a good manner, because, through the technique, like new developments and new technology, we're trying to, come up with solutions. But
cleaning more and more
and cleaning more and more.
and with the devices and
Yeah, but they didn't realize what happens, that it is actually impossible to fill this 100%. It cannot happen. And so there's always a chemical load in terms of the in terms of the filling, which is being filled in the tooth, but also the bacteria, which is being, influencing your whole body.
and the toxins of bacteria.
And also the energy path is blocked as well. So it's, according to traditional Chinese medicine, it is just like holding some of the energy in and contributing to a systemic problems. So that's how I do explain to my clients. And so what happens to this young gentleman? So he came over. He actually did not complain about hurting tooth. You would have assumed most people, and that's probably what you guys do, you come over to see your dentist and you think like, okay, it's a dental thing or issue when you've got a pain in your tooth. But this guy didn't have a pain. Most people actually do not have a pain. But then when we did initial assessment and we did take the x-rays, we saw the root canal treatment on the lower, I think it was left 6, and it was a massive inflammation around the root canal as well, which means the whole around the root canal treated teeth, the bone was being damaged. And obviously you do have little nerves and vessels in that area which are leading to a bigger nerve and vessels in your head, and that what is leading to other parts of your body. So in my eyes, it is a common sense that everything is interconnected and it actually influences your body. What we decided to do, I have explained in everything. He decided to have the tooth extracted, so we removed the tooth. And when I saw him the very next time, he was telling to me that it's just like almost unbelievable that he just stopped having the issues, the bloating and all the symptoms and, the digestion problems he's had. And he was actually, as a matter of fact, taking a lot of antibiotics for it, because that's what his general doctor suggested. And he came over and he was telling me, I'm just like fed up of the antibiotics. They don't work. I'm being more sick and I don't want to take it anymore. So this simple thing has actually, which means, a simple thing for us to remove the tooth, had immense effect on his overall health, but like even like energy levels, even like emotionally, because he could have functioned normally. So he was very grateful.
Perfect. So these were the examples of chronic inflammation. There's one more, and it's connected with wisdom teeth. So there's lots of inflammation around wisdom teeth because,
Could be.
yeah, in our evolution, there is no space for wisdom teeth anymore.
Why is that, do you think, Eva?
Well, I think it's because we started processing all the food, cooking. We don't eat hard food. It's
So
just
the jaw is not being
the jaws
used.
is not stimulated to grow, which is actually what I tell to young parents. In order for their jaw to grow, it's very important to chew on hard things.
Yeah,
and
maybe
swallow
even
properly and breathe through your nose, not mouth.
and maybe we can even go, like years ahead. Like even we start with lactation. So a lot of women like not lactate their children.
They don't breastfeed.
They don't breastfeed, which means the little kids do not have the sucking motion, which is actually helping them
the palate to grow.
The palate to grow and the jaw to be, grown in a good manner. So
that's why the wisdom teeth, they usually stay partially erupted.
And one more thing, if I jump into it, we didn't say it's nutritions, meaning there's not enough vitamins and minerals in our food, and that's why we're lacking, especially vitamin, K2, D3, magnesium, and that's why we're just like having issues with the wisdom teeth.
But there's a great book from Weston Price. He's talking about this evolution, and he was studying cultures 100 years ago, and that time we were lacking vitamins and minerals. Anyway, so that's very common inflammation with clients. They come and they complain with inflammation, or they don't complain because the body is very resilient and they don't about the inflammation, but we see that they're partially erupted or there's just gum overlapping the tooth and it creates a big inflammation. It's usually sensitive when we touch it very little. That's why clients, they say, okay, I can feel it. I see that. I see the big swelling when we see that in the mirror. And it does affect the general health. So we had lots of clients, we help them with their heart issues because this tooth is on a meridian with heart and small intestine. So some other clients, they would improve with their...
But not only that, like I've got a lot of people where we help with like mood issues, because not only that the wisdom teeth are on the meridian with like, the main organs are heart and small intestine. So the symptoms we were just describing, bloating or digestion's problem, but also like palpitations or high pressure, but also it is a main energy metabolism in Chinese medicine. And so I do have a lot of clients who come over for initial assessment complaining about, some say I've got anxiety, some say I'm sad and I have no reason why, some say I've got panic attacks. I've heard panic attacks, the very, far end, and depressions also. And these are young people. And, mostly they say, actually, I don't have a reason to. And I do feel like there's something wrong with me. And I don't know what it is. And so again, we're here for them in the dental world, just to say what it can have interference with their overall health. And the wisdom teeth actually are big source of these complaints. I think we're going to have definitely another solo episode, Eva and me, about our experience, because we've both had wisdom teeth quote unquote issues, but this is something for an extra episode. And I've seen energy levels in me like big time improvement, and even like the confidence and self-worth feelings so much stronger in me. So we will share it in some other episode.
That's why we are attracted to share with others, to bring them more optimized health and happy life. So I think this would be regarding chronic inflammation.
So remember, guys, like mouth is a mirror of your overall health, and we can't wait for another episode to share more stories.
Thank you for joining us on Healing Through Dentistry.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile. Take care, and we'll see you in the next episode.